the primary aim of the vision center, let us discuss about that, and then see how it can help your practice, building up your practice, and also moving you to the community. So I just want to share with you the journey of my 31 years of practice in 1993 started, and then this is how it started in a two-room clinic, and now it's a very huge complex. And these are my initial days, and then and this is the community eye camps we've been doing from very long time, from 1993. So how this vision center concept has come to our mind, this is the question now. So when we are doing this vision centers all over, when we are doing this eye camps all over the place, then we got associated with one of the NGO, that I'll come to you later. And then that's the Operation Eyesight Universal. And then we are continuously doing these camps. But then they gave us an insight, asking us to tell us, they were enlightened us about asking us, why can't we do to us in a structured program in a structured area? So that's how the Vision Center concept started. But then when we are doing these camps in one of the areas, that is a urban cooperative bank, and they asked us, this is away from almost 30 kilometers from our place, they asked us to have a vision center there, and then that's how we started. So then why the vision center is, we do the comprehensive eye care services in this area for the people who can't travel all the way to the main center, and then it's very to the rural public. This is for the rural public. And then the selection is like vision center, the concept is to take care of 50,000 population in a rural area, which is away from almost 40 to 50 kilometers, and it's a permanent facility where an ophthalmic assistant or an optician who is trained in the main center will take care of the vision center. And as you know, there are 39 million blind, and then almost most of the population are in India. And good news is 80% of them are we can rectify them. And these vision centers, like who cannot travel or don't have this economy to travel all the way and then pay money for this treatment, are taken care in these centers. And as you know, the common causes of blindness are the refractive errors, the diabetic retinopathy, and cataract remains the number one, and of course the glaucoma and other diseases like the degenerations like ARMD. And most of them can be treated. This is what I was discussing. So it's a cost effective, because these vision centers, we don't charge anything for the patients. But I'll tell you how it could assist you in the development of the practice, both economically and also in the numbers too. So prerequisites are a referral center should be there around for 50 kilometers, and then a telemedicine should be established in this area. And staff should be very well trained in all these things, and the financial qualification should be there for a person who takes care of the organization there. And of course, equipment should be updated and then maintained properly. And the main key factor is the community engagement. The community should be engaged in this, and that's how once they have the ownership of this center, that's how they come to the clinic and then have their eye examination done. And of course, the manpower we have to take care in these centers. And this is how we started the first vision center. And the community involvement, we can see it's not just the eye examination we do, but we take care of the public, including them some common education of the hand wash techniques, and then updating them about menstrual cycles, and then about their getting them awareness of the vaccination, and all this we do, and that's how we get engaged into the public. And of course, about the common diseases like diabetes, hypertension, asthma, and how can the eye gets affected with this, and a holistic approach. These ophthalmic assistants, they go to the community and then talk to them about these problems. And of course, we have a key performance indicators where we see we audit them. We have regular audits where we keep checking how many patients have come and what are the regular problems they have in the rural area, and how they have been treated, and how they have been referred to the main center for the treatment. And of course, we got our vision center model. I say that is the best because we got the best of our L.V. Prasad Institute and Arvind Eye model. And we got into some now 8 centers we have. Of course, the Rotary International is a part of 2 of them. And this is how we started with a small clinic initially, and then we expanded it to 8. And the plan is to make 54 vision centers in the rural Telangana area. And most of them, the refractive errors are identified and then treated, glasses are prescribed, and this is how you can see the community being involved. And this is the latest one where with a good branding and all that we do that. And of course, a patient with the diabetes, we dilate and then take a photograph, and then that is being sent to the main hospital. And the manpower in the vision center is 1 optometrist and 1 coordinator. And these people, they stay in the fixed hours in the vision center, and then they go to the village for the camps. And of course, we have the community health workers who assist in each vision center, depending upon the clusters. We have up to 5 to 8 clusters in this for a vision center, and we have 1 health worker for 2 cluster areas. And the advantages are service on the spot, and there is early detection of any problems there, very cost effective, and community engagement is there, the capacity utilization is there, and also the referrals to the main center where we can have more number of patients in the main center. This is how the structure is there in our area, and these are the vision centers, the probable areas where we are planning them. And we have a model like 30% are free, 40% are subsidized, and 30% we charge depending upon their economic situation. And of course, these are the numbers we have done, almost 18,000 free surgeries in these camps and vision centers referred by the vision centers. Subsidized surgeries, as you know, to 2009-24 subsidized for the farmers in 14 villages, and out of the 44 villages, 14 villages are being declared blind free. And this is the hospital, the latest hospital we have, the complex in Warangal, and we are moving forward with the secondary centers in other areas, that is in Nizamabad, and another 44 are adding to the 8 numbers. This is how the rural Telangana looks like, and this is where the plan is. Thank you very much. And join FBS AOS. Thank you very much. Any questions? Yeah, thank you. So shall I finish off my second one also? I'll do that. Yeah. This is about the training fund, making the future leaders in our community, that is ophthalmic community. So why is a training needed for the post graduates? The question is, if you see the current status of ophthalmology training in India or in our state, especially in Telangana, it's not uniform, because when you see the training part all over India, it is not been, every area is different, and that depends upon the professors, and that depends upon the curriculum in that area. So it is even different from the government and also the private institutions. So we need to have the need is there for the comprehensive training and then a regular oversight. So why you need a training for these future leaders? One is to improve the vision for the patients and the leadership development. We have to make them the future leaders who can really do better, and then train more people. And collaboration and innovation, where they can be a part of the innovations and collaborations going forward, and be a part of the very big organizations too. So in 1990, there was a study done in Hyderabad wherein the L.V. Prasad Institute has done that, and then it has been published in the AOS also. It says that the most common cause for blindness in Hyderabad is getting operated for cataract. That was the situation in 1990s. That was the study done there. And you can see that the 7.2% of the blindness over 50 years is again because of cataract surgery complications. So there is a need for the training for the youngsters who can really do better. And there should be a partnership between the institutions where the government institutions can get partnered with the private institutions to send their postgraduates and get a training there where there are no facilities. And of course, being participating in the national programs and engaging with other NGO organizations. So here is the Manipal Health University, that is the MAHE. They got attached with us, even though they are a very big organization. They used to send their postcards to Warangal all the way, almost 650 kilometers or 700 kilometers to our place, where we used to train them on the basics of SICS and before the COVID. And of course, after that, there was they changed their pattern and now they are getting trained in the same institution. And the most important thing is the mentorship and the research. Say there, when they join an institution for a training, they have the mentor who can take care of them individually and also motivate them to be part in the research activities. So, and when they join a mentor, of course, they build their leadership skills also, and their engagement in different activities also will be there. And research opportunities, yes, there is a in these training programs we have this encouraging innovation techniques, allowing them to have their own ideas and then work on them and then give a better solutions, and publishing and presenting their findings on different cases at different forums. And of course we have we had a training program for the foreigners too. They used to come from Sweden, Egypt, and Latvia. And seeing that, we have started the postdoctoral fellowships in our hospital that is being recognized by the Health University of Telangana. We have a structured program and with a specialty focus, subspecialty focus, and involving them in the research and the audits and different medical audits and clinical audits of the in the hospital. And the mentorship is there, the networking opportunities they increase, and once they finish their fellowship, either we give a chance to join our association, or also they can go freely and then work anywhere. And these are our first fellows, second year, third year, and fourth year. And this is interesting because we have in one place our two fellows are competing in two hospitals, and one is our hospital, other lady is in the other hospital, but they're competing and they're doing very well. And thank you very much for giving this opportunity, and make sure that before you leave this world, train the youngsters. Thank you very much. Any questions?